The honourable member for Vermilion-Lloydminster. Please proceed.
Mr. Speaker, according to the Canadian Diabetes Association, Alberta has one of the highest prevalence of diabetes in Canada, with 217,000 Albertans diagnosed in 2010, or 5.8% of the population, and that number is projected to rise to 8.6% by 2020. To the Minister of Health, research has shown that the use of insulin pumps dramatically improves glycemic control for diabetic patients. During the recent election campaign, the government promised that Alberta diabetics would receive insulin pumps. Those patients are still waiting. When will the minister make this promise a reality?
Honourable Minister.
Mr. Speaker, the honourable member is correct that diabetes is one of the most prevalent chronic diseases in our population. It is true that we made a commitment during the election campaign that we would provide an insulin pump program for eligible insulin-dependent diabetics in Alberta. Mr. Speaker, we're in the planning phases of that program now. As we promised, we will deliver it in spring of 2013.
Honourable member.
Supplemental question, Mr. Speaker, to the same minister. Now, in addition to the initial cost of the pump at over $5,000, annual pump-related supplies can cost an estimated $6,800. Will those costs also be covered under this program?
Honourable Minister.
Well, Mr. Speaker, as we recognized at the time we made the announcement during the election campaign, the cost of the pumps and supplies and accessories are considerable. They will be covered as part of the Insulin Pump Program, Mr. Speaker. We made the commitment during the election. We said we would honour it beginning in spring of 2013. That's exactly what we intend to do.
A final supplemental to the same minister, Mr. Speaker. Given that the large number of diabetic patients in our province and the cost of these pumps and supplies, how is our cash-strapped healthcare system going to pay for all of this?
Honourable Minister.
Well, Mr. Speaker, we make spending decisions in our healthcare system based on population health needs as they are identified. As the honourable member himself pointed out, diabetes is one of the most prevalent chronic diseases in our society. The program that we will come forward with in the spring will provide eligibility criteria for insulin-dependent diabetics who may be eligible to be on the program. Mr. Speaker, this coupled with some of our other initiatives around funding diabetic supplies, for example, in the Alberta Blue Cross for Seniors program, shows, Mr. Speaker, that this government takes diabetes extremely seriously.